Okay, good evening, Dr. Amine. Welcome to our talk today. You know, uh, during our last conversation, we had great, understanding about the microbiome, and I think there were a lot of shared passion which we could see, and I thought this time we will discuss a very, I'll say serious topic, which is actually impacting a lot of people, specifically in the European market, right? And also because, it's something, I've been experiencing personally also because my father has been dealing with colon cancer. So I want to touch base upon, I'll seek your views on, the current situation of cancer, how, people have started developing, this dreaded disease, and obviously we'll touch about the role of the microbiome in the onset and progression of cancer. Yeah.
Excellent. No, thank you so much again for having me. It's always a pleasure as well to have this kind of discussions and to go into some of the details of the science, but keeping it as well understandable to the layman. Um,
Yeah.
so I think there are different things that we could touch upon when we speak about the role of the microbiome in cancer. There is one thing that we need to highlight, at least from the beginning, is that uh, what we know today from the role of the microbiome in cancer is nothing close to maybe probably making a drug tomorrow that will fix this issue, simply
Mm.
because we don't know much. And most of the studies that today are conducted on the microbiome or the gut microbiome specifically, they are conducted on healthy volunteers. The majority of the studies on healthy volunteers. And
Sure.
if you want to study a disease, a particular disease, specifically cancer, you want to really target those populations. And the issue you will have there, these patients, they have different comorbidities. They have their own chemotherapy for those who takes chemotherapy and so on. And they're not easy to recruit in the clinical trials, nonetheless longitudinal clinical trials. When I say longitudinal clinical trials, mean that these clinical trials that spans 10 years, for instance, and beyond. Some of these patients actually don't live to stay for
Mm.
10 years. And
Yeah.
hence,
Yeah.
this is nuance that we need to keep in mind that what we know today is limited. However, we do know that the microbiome from different body parts, namely the gut microbiome and the oral microbiome, plays a critical role into the development, progression, and maybe the efficacy of certain chemotherapies targeting colon cancer specifically.
Okay. Okay. So let us touch base about, so I want to discuss, because this is something a lot of people are still unaware about the microbes living in our mouth, right? So let us probably deep dive into a bit about the microbes living in our mouth, and because I mean we recently launched our product on the oral microbiome, right? And didn't been doing a lot of research around it, studies around it, and could found, it's not only about dental health, but it's linked to various aspects of our systemic health issues, starting from type 2 diabetes, cardiovascular disease, arthritis, right? Even autoimmune issues, and colon cancer, right? And even IBD. Uh so how does the microbes in a mouth impact the progression of a cancer, colon cancer, which is the third largest most common cancer globally, and the second largest reason for the cancer deaths worldwide.
It's the connection is very simple. I mean, what you eat through your mouth end up being in your colon. And what we know, at least from the significant amount of studies conducted on some biopsies from colon cancer, we did identify two key microbes. One of them is called Fusobacterium nucleatum, and another
Mm.
one called Porphyromonas. And these
Mm.
two, especially Fusobacterium nucleatum, is a resident of the oral microflora. It basically
Yeah.
lives in your mouth. And
Yeah.
somehow, we don't know how, it ends
Mm.
up in your colon, and it's
Yeah.
one of the third cause of actually colon cancer. And these bacteria basically specifically produce certain molecules, and namely proteins. One of them is called FAP2, that
Mm.
that enables the cancer to evade from the immune system, and it's like a shield for it. And today we do know that we can basically maybe target this specific protein of that specific bacteria, probably to block the
Mm.
cancer from progression, and also improving the chemotherapy. But going back and when it started in your mouth. So today, when you're brushing your teeth with divers of chemicals, right? And divers of mouthwashes and so on, that will probably clean your mouth, may smell good, but it will probably kill most of the beneficial bacteria. Uh, what you want to understand is if you're moving something from one place, you will get a replacement because we don't like emptiness in our body. Our body is filled and it doesn't like emptiness. It likes when it's filled. If you're displacing healthy bacteria from your mouth with a mouthwash and very nasty kind of chemicals and some of the toothpastes,
Mm.
you're giving the opportunity to other pathogenic to actually take place, right? And those pathogenic, they will be traveling to your colon and then making another, let's say, dysbiosis that will lead to cancer and other diseases, IBD, and so on and so forth. What we know today that these microbes travel potentially through bloodstream. Some of them they end up also into cardiovascular diseases as well, which there is more or less of a connection there. We don't know how to treat, though. I mean, we don't know whether, I mean, no one had succeeded yet to actually give antibiotics and get rid of Fusobacterium nucleatum, not yet. But we do know that some of other good bacteria, they could improve the efficacy of chemotherapy. And I think a lot of science is now being towards that. One of them is Akkermansia, known as also to be good for pre-diabetes and for obesity. It's also
Yeah.
known to improve the efficacy for some studies of immune checkpoint inhibitors in chemotherapy.
So another 2 points I want to add and even discuss. So one is obviously you brought a great point about the toothpaste and the mouthwashes, right? So I think for everyone who are listening, right, it has the same impact what antibiotics have on our gut, right? So it actually wipes off most of the bacteria and it gives, as you rightly pointed, it gives is opportunity for P. gingivalis and Fusobacterium nucleatum to grow and then start doing pathogenic activities, right? So one way, obviously, we know that, because of we swallow 1 liter of saliva every day, and through that, a lot of bacteria move, right? And obviously, Fusobacterium is actually so essentially, I wanted to ask two things here. One is, I was actually found a lot of information about it that if you are too much on PPIs, right? If you have an acid reflux, right, and we are taking too much of PPIs or antacids, right? So it actually uh, creates a smooth pathway for Fusobacterium to actually reach the gut, right? And that is something which I want to discuss first point. Second point also, uh, from a P. gingivalis perspective, so we know it is there in our mouth, right? And if it's not dominating the ecosystem, it do help in formation of biofilms. It do help in certain remineralization of minerals, which helps in our teeth health. So how so essentially we know this bacteria, if it grows, it can do bad things, like it can get into gut and do create a situation of cancer. So how do we maintain this balance? This is really really important, because we can't say that we have to kill P. gingivalis, because it also do something, formation of biofilms which do help, in remineralization.
Yeah, so regarding your first question and the people who basically take some like antacids and stuff, um, what we need to understand there is no better fix than actually properly having a very nice diet. because it's all start with food as medicine. And I think if you maybe sit down one day and rethink through your week, I think one of the good ways I find it very helpful is you just record during a week what you're actually ingesting.
Mm,
Just
mm.
record every day
Yeah,
for a week. When you end
yeah.
up your week, look into what you have actually eaten. Don't change. Don't change because you're actually recording. No, just do the normal day, the normal week that you usually do, and you record what you have ingested. Record what processed food, how much of those ones have actually contain food preservation and all that stuff. And when
Mm,
you look into that, you will be stunned how much of sugar you've actually eaten, processed and non-processed, maybe how much less fiber you've actually eaten, and so on and so forth. When you look into that, and you maybe incorporate some more fibers, and that will enable your gut microbiota to be healthier, balanced. I
mm.
think you will already fix in probably 60 to 70% of the issue,
Yeah.
basically not needing to have those antacids,
Mm,
um, eating 2 hours before you go into bed, and so on. Practicing some walking if you don't can, if you can, don't can, if you can not practice sport, and so on. And this all together will enable you to be healthier and will reduce the chances of you having this bacteria going from your mouth and sticking into your gut and causing those issues.
yeah.
As to the second questions, which you've mentioned, um, was about having how can you actually maintain a balance in the oral flora?
Mhm.
You cannot maintain a balance if you don't know whether there is a balance or a disbalance, right? I mean, first
Yeah,
of all, you need to understand that. And I think one of the first signs is if you have a smelly mouth or you have some leaky gum, similarly to the leaky gut, like some
yeah,
blood coming out,
yeah,
maybe your
yeah.
teeth a little bit like yellowish and so on. You probably have the early signs of an unbalanced oral flora. And what you need to do there is similarly as we do with the gut, although the tests are coming and are improving, you can start testing your oral microbiome and see what's the status, because I cannot go and recommend to people do XYZ. I mean, I cannot
Mm,
go recommend to somebody start taking vitamin D or start adding some iron unless I do a blood test. I mean, I'm not a medical doctor, but if I
mm,
go to my doctor, he will tell me, listen, do your blood test, and I know if you have anemia, and I'll recommend you XYZ.
mm,
Hence, for me, when people start telling me, do I have a disbalanced oral flora or gut flora? I said, I don't know. Maybe you have
mm,
the signs of that, but I don't know whether you or you don't have it.
mm,
Meaning, go test with the current testing. The technology is improving. There are
mm,
still some flaws, and within how the data is processed and the database is
mm,
available, we know those flaws. However, the technology is improving today, and there is better kind of output. And once you have tested your oral flora, you know what's the status.
mm.
We can decide what approach you can go with. And I think the first thing is reduce using those bug killers like mouthwashes and so on and so forth.
Yeah, yeah. So it's great points you have shared. So for everyone, it is important. First thing is obviously the reduced consumption of sugar, because we all know that sugar in the mouth increases our acidic pH level of the mouth, which becomes a breeding ground for pathogens, right? Apart from it makes us gain weight and a lot of these things we know, right? Processed sugar should not be consumed, but we know that sugar is converted into this, salicylic acid, or lactic succinic acid, and these can increase our acidic pH level. And second point, which you rightly pointed out, right, mouthwashes are just clearly disaster. We should avoid them, because we don't know we do that. And I've seen, a lot of toothpaste have SLS, parabens, saccharin, aspartame, right, which are really really harmful, right, which actually changes our gut flora, oral flora, and it actually impacts our hormonal imbalance and a lot of these things, right, and also. So one thing I wanted to discuss, this is really really important, which you mentioned about the bad breath, right? So when we think of bad breath, especially in the Indian context, people think of onions, right? So don't eat onion, don't eat garlic, right? But we what we really don't know that, certain cruciferous vegetables, right, can also cause bad breath through sulfide production, right? So it's not always that all vegetables are good or bad, right? So obviously bad breath is one of the signs, leaky gum or leaky mouth, whatever we call it, right? It is also just an inflammatory response of your immune system, right? So essentially these are few of the essential aspects we should consider when we talk of oral flora. Another point from the oral microbiome I wanted to ask was the interaction between the fungi and the bacteria, right? So
Sure.
Candida strains and the interaction between Candida albicans and Streptococcus mutans, or interaction between Candida albicans and Fusobacterium nucleatum, right? How this actually impact the progression of colon cancer.
So I think you touch upon a very important point there is this. So when we speak about the microbiome, we tend to think that it's only bacteria, and there is a misconception. I mean, scientists do know it's not just bacteria. We define a microbiome as bacteria, fungi, yeasts, and archaea and viruses. This is the combination of all of them. However, when we do studies, we tend to actually look mostly into bacteria by doing 16S amplicon amplification. I mean,
Mm,
when we do metagenomics, we get everything, right?
mm,
What we don't communicate enough to the public is that it's not just the bacteria that they have a role into your health or your disease, but it's also the interaction between what the bacteria produces and what the fungi consumes and or produce. Do we know how these two interact from a mechanistic point of view? The answer is no. We do know that there is some kind of either antagonistic or mutualistic interactions between those. There are some
mm,
molecules produced by a bacteria that the yeast could potentially use, and vice versa. For instance, there is an example which is an easier probably to understand. When we look into candidiasis, which is the overgrowth of candida in the vagina, which basically cause a lot of kind of vaginal discharge and irritation and so on and so forth. That is mainly led by a disbalance in the vaginal microflora by an increase of aerobic bacteria, right?
mm,
So it's more of this increase of aerobic bacteria will change the pH of the vagina,
mm,
allowing candida to actually grow and cause the candidiasis. So the bacteria will will be disbalanced, maybe because of the food you ate, or because of the antibiotic you took, or because the mouthwash also took.
mm,
That disbalance or dysbiosis, or maybe a change from one equilibrium to another completely different equilibrium, will change the physiological status of your mouth or your gut or your vagina, hence
yeah,
creating a favorable environment to other pathogens, namely yeasts or fungi or viruses, to thrive. So this is the kind of one serving the other, but at the start of everything, it will start from you. It's your behavior who basically led to that.
yeah.
Whatever you consumed or whatever you took led to
Mm.
that mutualistic interaction between these types of microbes to lead to the disease you've actually encountered afterwards.
Okay. So I think this is really really important because we actually from a female perspective, obviously, vaginal microbiome is something untouched, not discussed too frequently, right? And we do know that the imbalance in the vaginal microbiome is linked to STIs and a lot of infections and even situation of PCOS, and we know Candida is linked to a lot of these female born issues. And also uh, we have also know about the oral candidiasis, right? So essentially, a lot of this sugar what we eat do feed the yeast and fungi, which causes oral candidiasis, which actually leads to the growth of certain pathogenic bacteria, as you rightly pointed out, so cross feeding, direct feeding, or the interaction, because when they form biofilms, they also combine, and they try to make sure that they survive the ecosystem, right? So, another thing before we actually wind up, and I want to touch upon this and briefly about the gut microbiome. One was, so gingipain, right? Again, gingipain is released by gingivalis, right? And again, uh, how does this byproduct actually uh, make sure that these other pathogens grow, right? Because that is another one of the key biomarkers or key understanding point on the progression of colon cancer via oral
So,
microbiome.
my main expertise, I would say, is more on the Fusobacterium nucleatum, where I have basically worked on these FAP2 proteins and
Mm-hmm.
how they interact with the immune system and mostly how they fight it away. Um, what I know is, at least from a molecular perspective, this is more too scientific, is that there are some modifications that even happen onto the non-coding RNA level. So when you look into the DNA, we have the DNA, we have the RNA, which is the second step, and then we have the proteins. But we have some DNA that codes or gives some RNAs that does not lead to a protein. And the environment where the, or maybe the microenvironment where the bacteria is can lead to some expression of microRNAs that will give this pathogenetic status of the bacteria. When the bacteria is this microenvironment, they start producing byproducts, as you've mentioned, and the interaction, it's either blocking the access of the immune cells and their differentiation, on the other hand, it could also be blocking the efficacy of certain chemotherapy drugs like immune checkpoint inhibitors, for instance. And this is
Okay.
more of a complex. Today, we don't know exactly what's the mechanism of action of these byproducts, simply because it's very difficult to access this
Mm,
kind of models. I mean, if we would try
mm,
to create models, there are some CRC or colorectal cancer mouse models that enables us obviously to do these kind of studies, but still does not replicate or correlate with what happens in humans. So we're still learning on how microbes are working. What we know today that microbes, they do two things. If there is a balance, everybody is happy. But in case there is a dysbiosis or a disbalance, they start moving towards some organs. And if they reach, they create what we call some kind of microenvironments, and some will become a tumor microenvironment because we could literally isolate some microbes from some tumors, and there are not many of them that can reach this microenvironment. But if they do, it's very difficult to displace them. However, there are some scientists who manage to engineer some microbes to actually penetrate this tumor microenvironment and potentially deliver drugs. We're probably 5 to 10 years to actually get in this to actual drug that is approved by the FDA and EMEA and others. But
mm.
there is quite a promising, I would say, future for these types of therapies or microbial therapies.
Okay. Okay, great. So, so before we close our discussion, I briefly wanted you to touch upon, uh, gut microbiome, right? And probably we can have another round of discussion later on detailed discussion the gut microbiome. But obviously we know these bacteria, Fusobacterium actually is an oral microbiome which is found in the gut, which is one of the reasons for colon cancer, right? But there are other bacteria as well, like E. coli and Enterococcus faecilis and all these, right? So what is the mechanism of these, how these microbes are actually, what kind of metabolites these produce so that it creates that inflammatory response which triggers situation of CRC?
I mean, what they don't produce is also the
Yeah,
question. So
yeah.
an increase of so we know that a balanced microbiota is a microbiota that produces a significant amount of short chain fatty acids, including butyrate, propionate, acetate.
Mm,
Also, a balanced microbiota produces significant amount of GABA,
mm,
for instance, that is known for gut-brain axis. Uh,
mm,
90% of the serotonin is also produced in the gut. A reduction of these, let's say, anti-inflammatory bacteria like Bifidobacterium, Lactococcus, and many others. The reduction of them will lead to reduction of production of short-chain fatty acids. When they do produce the rest of this pathogenic, they start producing branch short-chain fatty acids, branch fatty acids, which basically are more inflammatory than anything else, right?
Mm.
And then you have a reduction of short-chain fatty acids. They're more of a marker of a healthy microbiota, and an increase of other byproducts and molecules that are rather associated with inflammatory. It's also there is an increase of the pH that is also to be noticed, and this all is more favorable to other pathogenic bacteria that basically would lead to the dysbiosis and hence increase in the inflammation of the gut.
Okay. Okay. Great. Okay, great. So that was great, Dr. Amin, for your great insightful discussion since we have short time today, right? So we may take up another talk on the role of gut microbiome and cancer, right? And probably I'm thinking we will also we'll talk a bit on the vaginal microbiome also, which actually has been unexplored, right? And I think you do a wonderful job. You are sharing a lot of good stuff about the vaginal microbiome. So I've been following your content a lot, right? So thanks,
Yes.
Dr. Amin, thanks for your time,
No, thank you
and
for your time, and
I think
thanks
your
for having me.
insights yeah. Thank you. Thanks a lot. Take
Thanks.
care. Thank you. Bye-bye.
Cheers. Bye.
Bye.